Hello everybody, this is Hannah for 4 minutes, and today's video we're gonna speak about analytical method validation, why we do it and how we do it. But before we start, let's tell you a quick story. There was a master student. She done his master in 2 years. 2 years of hard work, pre-formulation studies, formulation, drug release, quality control, and everything. She was really excited. She was really excited about the results she was getting. But at time of thesis writing, she realized something very important. She've done a fatal mistake. She didn't validate her method, which means that all the results that she got using the analytical method are not acceptable, which is really bad. So let's start. Why we do analytical method validation? The first thing, as we know, as we just said now, that for results reliability, to confirm that the results we are getting using this analytical method are accurate and precise. Number 2, data recognition. To let the scientific community know that the results you are getting are valid for the intended purpose, are reliable. Number 3, if you are dealing with official bodies, you need to let them know that the method that you used to do the in vitro and in vivo studies, the bioequivalence studies, are reliable and valid for the intended purpose. So it looks that analytical method validation are really important in pharmaceutical work and all chemistry actually. So how to do that? How to do analytical method validation? The first thing we need to do is that we need to confirm the selectivity of our method. So what does this mean? This means that we need to confirm or to know that our method can determine and measure our analyte or our drug even in the presence of some potential impurities. Why we speak about impurities here? Okay, when we do pharmaceutical work and drug analysis, your drug might be degraded by time. When you do quality control studies, you don't know. So you need to confirm, or you need to know if your method is able to identify your drug even in the presence of impurities or not. So how to do that? Okay, the first thing to do you might do is that you prepare a solution of your standard drug, standard analyte, then you spike it with some potential impurities. Then you determine your drug in the presence and absence of these impurities. Yep, cool. Then you monitor your peak, the drug peak, the response, the area, the height, the shape, and see if there is any change or not. You might also look for if there is another peak for the impurity or not. Okay, what if there is 2 peaks, one of the drug and one of the for the impurity, okay, and they are away of each other? Then that's fine. This means that your method is selective. But what if they are close to each other? At this time, you need to calculate the resolution factor, which should be at least 1.5 according to ICH guidelines. But ideally, it's better to be 2, because you don't know. Sometimes if it is even 1.5 unacceptable, but sometimes it changes in temperature, ambient temperature, or the pitch of the mobile phase, can it change the resolution factor and below 1.5. So it's ideally to be 2, okay, or above. Okay, but what if I don't have these impurities? Yeah, that's very common, especially that the impurities are really expensive compounds. In this situation, you might go for degradation of your analyte. So you do a forceful degradation of your analyte. Then again you prepare a solution of your standard drug which is not degraded, and you spike it with the forcefully degraded sample. But here there is a problem, because you might not really know about the degradation product and how much of the drug has been degraded. Then there is a much simple way to assess the selectivity and specificity of your method, which is the peak purity test. That all the HPLC machines have a software that can see and assess your peak. If it is belong to only one compound, then is it specific? It is a specific, or there is a coalition of different compounds as the same peak. Now, after determination of the method selectivity, we can go to the method linearity and range. What do you mean by method linearity? That we need to know the range of drug concentrations at which the method can give you linear results. How to do that? You prepare sterile dilutions of your standard solution, okay, in triplicates. You determine them. Then you construct a calibration curve. The response, the method response, the peak area, for example, against the concentration. You determine the equation, the linear equation of the curve, and the regression coefficient. According to the guidelines, the regression coefficient should be at least 0.995 to the method to be acceptable. But please pay attention to the linearity, because after doing the linearity, if you got any results that are out of the range, for example, you've done a linearity range between 1 and 100 microgram per ml, but during the release study you got one of the samples with concentration 130 microgram per ml. These 130, these sample are out of your linearity range, and you need to modify the concentration by dilution of the sample or something to get it within the range. Otherwise, is not acceptable. We done the linearity, so let's go to the next step, which is the accuracy. And we mean by the accuracy that we need to know if the method can get accurate results or no. Accurate means close to the true values. So how to do that? We prepare a standard solution, non-concentration of the standard analyte. Okay, cool. Then we determine the concentration based on the linear equation that we got just now. Now we have two concentrations. The calculated concentration that we got from the linear equation and the calibration curve, and the non-concentration because we know already the concentration. We compare both concentration to each other, calculate the standard deviation, which should be according to the guidelines not more than 2%. Cool. The fourth parameter we should do is the precision. And the precision, we need to know the method can give us reproducible and repeatable results or not. How to do that? We prepare, there are three levels of precision. The first one is repeatability. Okay, how to do the repeatability? We prepare a homogeneous sample of our analyte. Then we determine it 6 times from the same sample, same machine, at the same time. Okay, same day, same analyte. Then we compare the results and we see the deviation among the results. The second level of precision is the intermediate precision, in which we change the machine or the day or the analyst. Okay, for example, you do this sample today, and you do it tomorrow and the day after tomorrow, and you compare the deviation. You get the deviation among the results. A third level of precision is a reproducibility, in which we change the lab. Okay. Anyway, the standard deviation according to the guidelines should not exceed 2% for the drug response. After determination of precision, we go for another important parameters, which is LOD and LOQ. What are LOD? So these are the minimum concentration of your analyte that can be detected and quantified. Detected is LOD, and quantified with acceptable accuracy and precision is LOQ. How to do that? We run several dilutions, low concentration of your sample, and the concentration at which the signal to noise ratio is about 3. This is your LOD. And while the concentration at which the signal to noise ratio is about 10, this is your LOQ. That's it. So let's go to the last slide, which is how to do it. What is the plan? Okay, the first thing to do is you need to determine the target concentration range. For example, if you are doing a release study and you're expecting the concentration to be between 20 to 80 microgram per ml, then you might need to run a calibration curve around 1 to 100 microgram per ml. After determination of the target concentration, prepare suitable working solution. From this working solution, you prepare at least 5 concentrations in triplets for your linearity range, and 3 concentrations for your accuracy evaluation, and at least 1 concentration for your repeatability and precision. And you might go a bit lower with concentrations with dilutions for determination of LOD and LOQ. You run all these in triplets, and you construct your calibration curve using the linear equation of the calibration curve. You calculate the accuracy and precision of your method, and that's it. It's very easy. If you have any questions, please let me know. See you next video. Bye.